crowding in here to have a look and see what we're going to do.
Can't hear you. Closer to the mic.
Closer to the mic. I'll have to hold it. Okay. That better?
Yes.
Fine. We've got 3 ladies that are allergically sensitive, and the experiment is as new to us as to you. We've both Bill, Rae and myself have tested quite a number of people for electrical sensitivities, but we haven't tested these particular people, so there may be absolutely no effect at all, and they may feel quite unwell 24 hours later. You as well may find that you provoke symptoms, so if you do feel an uncontrollable need to throw up or anything else, then do take the door quickly. I hope there won't be, but the incidence of allergic response in a random population is something over 10%. I think you certainly agree with that, Bill. So I think the first thing to do is really to tell you a bit about that in Dr. Rae's lecture you saw the details of a clean environment. Well, you haven't got one here. As soon as you walk in the room, you notice that there's a strong smell of electronic equipment and carpet preservative and everything else, and that sort of thing would just make it impossible to get any reasonable baseline in a test. And so the first thing really is to take any questions at this stage, and Bill and Dennis will try and deal with those, and then we'll take simulate some sort of case history of the patients to demonstrate any allergic responses that they can describe and electrical sensitivities if they know that they've got any. And the facility that I've got for testing electrically is just a rented laboratory oscillator, and because there is so much electrical equipment in the room as well, I've got a pigtail effectively just stuffed into the outlet, and this will produce enough field in the environment around these people that if they have got an electrical sensitivity, then it will trigger it. There's usually enough in the low frequency region, leaks out of the power cord and through the case of the instrument. So I would initially, that's right, take the box 10-20 meters up the corridor to a power outlet outside the room, because to be able to get a useful response, you don't want to trigger the reaction so severely that it takes an hour or 2 to subside. So you want to try to work on the minimum response that the patient can describe a symptom to you. In principle, I suppose one could use one of the electrical testing machines, but we haven't done that because of the risk of one electrical machine interacting with another, and you just won't know where you are. You may well finish up with the 2 machines talking to each other and ignoring the patient. So at the moment we work on patients that can describe symptoms that do change when the electromagnetic frequency in the environment changes, and that they get these responses within 10 seconds or so, and the full reaction that they're going to get is complete within a minute, so that you can go through the whole range of frequencies, and I quite often go from below 1 hertz to over gigahertz, and that can take several hours to go right through. This particular oscillator will in fact go sub-hertz to 50 megahertz, so that there should be a reasonable chance of finding some responses there if there are any to find.
What kind of oscillator is that? Is that a microwave oscillator?
It's a WaveTech 50 megahertz pulse stroke function generator model 166 for the tape recorder, and it is rented with a $50 charge minimum dollars for unreturned accessories. So, any questions at that stage? Yes.
Did you say that approximately 10% of the population is allergic to this electronic pollution? That in your estimation?
I think that's a good possibility. We're sensitive to them some way.
Are the responses more prone for sine waves or square waves with a complex waveform versus a pure waveform?
I've tended to stick with pure sine waves for this. For the experiments with sort of simple cells, I used square waves because of the difficulty of defining a magnetic field level with a sine wave. But for these, I've just taken as pure a sine wave as the instrument gives. But there are problems with instruments, and this, I suspect, is a straightforward analog instrument, and that's what I asked for, but some synthesize the waveform, and you don't actually get a nice smooth waveform, you get lots of little staircase functions, and those transients can cause problems with triggering the patient at the frequency of the transient rather than the frequency that you think you're using, because you're dealing with a very non-linear system, and they may be insensitive at the frequency you've got, but very sensitive where the transients happen to be.
I'm finding most of our pollution nowadays is square waves involved computer-generated products.
Well, the computer output will trigger these people.
I'd like to know, I don't speak here, from the people who are whether they have noticed two interesting events. One is that since July 1976, the Soviets have produced an extremely low frequency 10 Hz signal, which stopped exactly the same time that the Chernobyl reactor blew, and then have started again 4 days ago. Have they, have they noticed any such relationship in their own system? That's a basic, extreme low frequency field, and incredibly psychoactive.
This has been off for what, 2 months? It was off for 2 months, was it?
No, it's just
2 or 3
started
months.
4 days ago.
Yeah, again. Right.
So have you noticed any change in the last 6 to 4 days?
April 28th.
Sorry?
That would be difficult for me to answer because we have incredible pollution in my area.
Oh, I know there's lots of pollution all over the place. No, there was all
The subject can't differentiate between the bad chemical pollution that they've recently had in the environment and any electrical changes.
That's all curiosity.
Would it have been Tuesday?
Hmm?
Would it have been Tuesday?
Would it have been Tuesday?
Would be good Wednesday. Not that Tuesday, you're right.
We can't hear back here at all.
Yeah, I know.
Tuesday.
One person here says that they did notice something last Tuesday. I'm sort
But
of...
I mean, it would still be going on. It's 24 hours.
Yeah.
They started up there.
So one possible.
Nobody knows the significance of that low-level frequency, but they've been putting it out, like he says, for about 10 years. If you turn on, I forget which wave it is, but you can turn it on a band and you can pick it up.
Well, you can get the high frequency.
Yeah.
There's also a pure ELF magnetic field. Okay, I can discuss that later. I don't want to interrupt too much.
Will you say it was 10 hertz?
Yeah, 10 hertz.
That is used in several of the diagnostic techniques, like the Vega. No, it's not a Vega test. I do not know the English words for it. But the function diagnostic test to give an impulse to the person they want to measure, and look what the reaction of that impulse is. It's at least it's claimed as some kind of physiological.
It's supposed to be a tonic wave.
Pardon?
The 10 hertz is supposed to be tonifying.
Okay.
Well, if you read the biography of Tesla, you may remember that he tried to long-distance communication by stimulating the Earth cavity resonance.
Yeah, but he would do not use time. I don't want to distract
Okay.
too much.
Okay.
It's an interesting subject,
Yeah,
but I just want
it
to go
is.
for that particular.
Yes.
Okay.
What is the output of that signal generator, peak to peak or RMS, whatever? And has anyone done calculations on the field strength you expect from the pigtail that you've got in there?
No, I haven't. You can come and do it afterwards. The attenuator is only calibrated in decibels, and the function output, it's a 50 ohm impedance, and my guess would be you've got a few volts on the pigtail.
Okay, well, we'll take the first one, is Dr. Calabresi here. Dorothy. Have you noticed any phenomena that are related to any of the weather phenomena?
No,
Okay, have you had, what kind of symptoms do you get when you're under power line?
none that I've noticed.
Okay, have you had any symptoms that you would relate to any electronic phenomena?
No.
What are most of your symptoms? Asthma? That you have?
Primary is asthma,
Is that due mainly to foods?
molds and chemicals, most environmental.
Okay, are you getting asthma or in here?
More mic.
Are you getting a mold reaction in here?
No.
Okay. So basically, she has no history that we know of any electromagnetic phenomena. If any of you want to ask any other questions, go ahead and ask. If not, yes.
Do you feel a little bit maybe headachy the day after you watched a lot of television?
I don't watch very much television.
I think I've talked to her before, and I think basically she's got what I would call a negative environmental or a negative history for electromagnetic phenomena. Yes.
Would you be willing to describe when your asthma comes on, what brings it on, in terms of a continuous period?
I was a terminal asthmatic 6 years ago before I found out about clinical ecology, and at that point I went on a fast and made some major changes in my home. I don't eat and haven't eaten for 6 years those foods that cause the asthma so badly.
Which were?
Well, many foods, wheat, cheeses, many foods. I had other symptoms as well. I had migraines and intestinal problems and hives and sort of multi-system presentation over many years. But the primary thing that was really incapacitating was respiratory disease. Basically, I don't have problems now except with tobacco smoke because that's not a controllable thing. If someone lights up next to you at Disneyland or something like that. But generally, I don't have any asthma. I've not taken any asthma medicines for 6 years.
Question, any history of cancer or TB in the family, previous generations, or anything like that?
Not relevant history.
Go ahead. Just do it one more time.
Yeah, well, I'd like to take a look at the history from
Oh,
all of
okay.
them because I'm not so switched on later on,
Do you mind?
we travel together.
Excellent. Okay, Giovanna tells me that she was probably okay until age 8 when she had the measles, and then she developed asthma after this, and developed a series of yeast infections, I believe.
We cannot hear you back here.
She had a series of yeast infections after that, and then tell me some other things that you've noticed then.
One thing that might be significant is that I lived within a landfill, city landfill, for 20 years, which was closed for suspected health risks, public health risks, and in which the county did a study on the high incidence of cancer-related deaths in the area. Unfortunately, they ran out of funds, so that there was no statistically significant data that has been made publicly, no publicly stated claim insofar as this is concerned. The other thing is that across from the landfill, there was a naval tower, so there is a a possibility that I was having some kind of long-term adverse reactions to that, and above our home was also other power lines. And I would say by the time I was 22, I was totally disabled from symptoms ranging from confusion, depression, anxiety, insomnia, blurred vision. I mean, you name it, it's 2 pages. How much time do you have? That kind of thing.
Okay.
What happened when you get into, when you get underneath power lines?
Primarily, the kind of reaction I get is severely agitated, confusion, kind of perceptual distortions where things seem to get kind of darker. I see things kind of two-dimensional. It almost seems like a mural image. Those are the kind of symptoms that I get.
How about TV sets?
The only time that I'm aware of having a reaction was during the time I spent 6 months isolated in a totally clean room where my environment was very definitely controlled, and I would notice that if a TV or radio was on, I would feel very anxious or nervous.
How about computers?
My reaction to computers immediately is practically nothing. However, once I stop, usually that's when I start feeling a delayed reaction, which is the anxiety.
Tell me what happened to you when you had your MRI scan.
Aside from the claustrophobia, I had felt for 2 days practically totally clear, in which I have not had a day of feeling totally clear probably in about 8 years, where I could think clear and I couldn't provoke reactions. Also attached to a 24-hour EEG, and so I was trying to sniff perfume and turning on my gas stove, trying to provoke reactions so we could document this. And for the following 2 days, I wasn't able to provoke reactions. But unfortunately, the dream was over in about 2 days.
Please,
okay.
All of you, please.
You've got all the lead there is.
Does anybody have any questions with Giovanna? She also...
Yes, there's one question. I want to understand a little better about your after effects to video display terminal.
Okay.
I didn't understand that.
Okay, the kind of reaction I get, I usually cannot tolerate typewriters and that kind of thing. So the only way I've been able to do any kind of lengthy written communication I have found is computers, so that I don't have an immediate reaction to the computer other than a little bit of hyperactivity. I feel that my brain is considerably speeds up, and when I stop, it continues. My thoughts are accelerated, and I can't sleep for about 4 hours if I do it late at night.
You leave the environment in which the video display terminal is located.
Oh yeah, it's off and everything, and I will continue to have several hours of adverse
So you get
reactions.
the bipolarity response. Do you crash after that, then, after you get over your agitation?
Yeah.
Yeah. This is one of the principles I was talking about yesterday, the 4 principles for loading the barrel. She obviously gets a bipolar response. So you still can't hear? I said, this is what we were talking about yesterday. One of the principles that these people get. And they get the stimulatory phase, and they get an induction of probably different enzyme systems and perhaps their immune system. And then they crash later on also. I think there was one more thing. You were very chemically sensitive too. Mm-hmm. And once you got over most of your chemical sensitivity, did your electrical sensitivity change any?
Not at all. That has continued. I've probably been through most of the available therapies for the treatment of the chemical sensitivities, and I've not yet found any relief for the symptoms that I feel, let's say, before a storm, particularly.
Okay. What happens to you before a storm?
I can't understand what I'm reading. Sometimes my children's faces seem almost unfamiliar to me. Familiar faces seem unfamiliar. And it's feelings of unreality and that kind of thing.
Now, when do you clear?
Usually as soon as the sun breaks through the clouds.
What about when it rains?
It's almost instantly when it starts raining.
Okay.
It's almost spontaneous.
I think that's a real tip-off to electrical sensitivity, that if they tell you that the minute it rains, they don't have to see it. They can be in a dark room.
Would it be worthwhile, for the sake of the audience, among the three of you, to tell what happens from an electromagnetic point of view when an approaching storm comes? What are the preconditions?
Okay. Question is what happens when a storm comes, and I think our electrical people should talk about this a lot more, but as a dumb clinician, I'll tell you what I know, okay? That there is some kind of a field that precedes this, sometimes by 24 to 48 to 72 hours from what we can tell from our environmental unit. The clouds themselves, as I understand, are generally predominantly positively ionized, and they suck up the negative ions from the Earth at that time, although it is mixed. There's also an increase in pollution that occurs because of this that's held in, and the pollution gradients sometimes will go up hundreds and thousands of times. There's also an increase in mold concentration that occurs. So when you're dissecting this apart, you have to be careful that you dissect all of these. Also, there's a barometric pressure change, and the problem, we've monitored this in our unit, and the problem does not seem to have much to do with the change in barometric pressure that the symptoms occur. And it seems to have something to do more with electrical discharges.
I was wondering if you know anything about the frequency, because I have heard from different sources, like in the Biometeorological Institute in Holland, that the frequency could be anywhere from 20 hertz to 100 hertz out of the storm.
Do you know about this?
I don't have any better information than that.
That would be interesting to know.
Dennis?
They're actually in ELF.
This needs to be measured a lot more. One of our group is got his PhD in this, and he also happens to be a weatherman, and he's worked with this for about 8 years now. And as far as I'm concerned, we haven't shredded as much light on it as we would, but then if you listen to the weather forecasts on the radio, you understand why if you stand back and think about it.
According to Pressman's book, Electromagnetic Fields and Life, out of Russia, about 1972, any high-intensity field near the head tends to suppress low-frequency and increase higher-frequency brainwave, which fits in with the hyperactivity. And also, you pointed out briefly about microwave, Dr. Smith, microwave-inducing hearing sensation, but lower frequencies will also, and you can also get visual effects called the magnetic phosphine effect. And not only do you get hearing and visual induction, you also get these effects on the body. Endocrine and hormonal balance can come in here too. I wonder how many people are in mental institutions simply because they happen to be very, very sensitive to electrical field effects, and you hear all these buzzings going on. Nobody else hears these buzzings going on. How can you explain it? It's an experiential kind of a thing.
Yes.
And this is something we need to
I
know more
always
about.
smelled things and heard things that nobody else did, and I should never have told my doctor that.
Yeah, we've seen patients in the controlled environment where they actually could hear sounds, and you could turn off equipment, and sounds would go away that nobody else could hear. And in fact, we had a couple that really their teeth were acting as antennas, and they could hear, real profound things. And it was quite clear that if you turn them on and off, that they knew, and you could do it blindly without any problems.
Well, both of these areas are very good for prosthetic devices, and they're working on them right now, so there's some good hope for the blind and the hearing disabled in these particular areas.
Yes.
Does the patient notice any reaction when they go up on a tall building? When you go up an elevator, this would rule out any barometric change related to before the
How
storm.
about the airplane? I can tell you about an airplane ride better than I can an elevator ride.
Good.
And many of the symptoms, I mean, as we are ascending and descending, where everybody else is just sitting there comfortably enjoying the ride, I usually have intense pain in my head. It's like a stabbing pain as we change altitudes and we hit air pockets and that kind of thing. And I feel very, very dizzy, and I actually see spots. And
Do you generally do worse when you're in the air, if you're up there and stable, or do you do better?
I do better once we're
Yeah,
stable.
this is the thing that we see on predominantly, we've interpreted as being chemically sensitive people. And most of them do very bad on takeoff and very bad on setting down, because what happens is that the air intake is near the jets. And you get a big blast of fuel oil. I mean, you all smell that when you're sitting on the ground there and they're revving up there. And then we've noticed that people at 30,000 feet can read newsprint, for example, when they couldn't read it on the ground, or they had to read it in a box, And whether that has anything to do with the electric atmosphere also or not, I don't know. We have interpreted that as a pollution effect. Yes.
You have siblings. Did the siblings have the measles at the same time, or do they have similar symptoms?
They all had the measles at the same time. We all had it at the same time. None of them ever got as ill as I did. Each of them have had allergic problems, but they have been able to cope with them, and they're managed by standard allergy therapy. None of my brother or sisters have ever had the extreme chemical sensitivities that I've suffered from. And I think one major difference, too, also would be that I was in on a freeway accident, a head-on freeway accident, probably about 7 years ago. And I think it was probably a year or so after that I became more acutely aware of my chemical sensitivities. So that may be one differentiator.
In the back there was another one there.
In terms of the barometric pressure of flying, have you flown in a small plane, single-engine craft as opposed to a commercial plane? If so, did you notice any difference in that?
I've never been in a smaller aircraft.
That will very often distinguish this barometric pressure thing, since they're not so effectively.
Yeah, the problem with it is you always get the fuel oil problem going along with it, and that really will complicate the thing. But I've noticed the people in the small aircraft will tell you they may have a little problem when they go up and down, barometric pressure, obviously, and that they'll do fine until they hit a cloud bank. And when they go through a cloud bank, wham, they're in trouble. And that clearly is electrical phenomena. There's no question about that. And that's another way you can pick up those people by talking at that angle there. I don't, most of the commercials are above clouds, so that's ruled out, and you don't perceive that so much in a commercial as you go through it. But a small plane, there's just no question about it. Yes.
Did the pregnancy or the delivery change in it?
Yes, my yeast infection was aggravated by both pregnancies. And whenever I had a flare-up of a yeast infection, my allergic sensitivities were always heightened. There was a definite correlation. And my mental instability or intellectual instability, whatever you want to call it, was always correlated to these yeast flare-ups. So I think that there was something hormonally involved. I had an irregular cycle, which was about 60 days in between menstrual periods. And it wasn't until my yeast infection and some of the allergies were regulated that I had a monthly menstrual cycle. So that there must be some correlation there, too.
Yes. Was there any depression postpartum?
The second time, it lasted 2 years.
Now you clearly see that on chemically sensitive people, and that can be prevented totally if it's picked up right away.
I was told I really didn't want my son,
Yeah.
and that's why I was postpartum.
You had the best development care, didn't you?
I only saw 35 doctors.
Yeah, back there.
Yeah. Can you tell me nature of the dental work that you have in your mouth right now?
I had 22 cavities by the time I was 5, and so most of the amalgam fillings that I have are corroding. And one dentist done, do you know what that machine is called? They detect the level of mercury toxicity. And he told me that the levels of mercury in my mouth surpassed that which OSHA would permit in the workplace. So he asked me to kindly close my mouth as I left the room, so as not to contaminate anybody.
There's some studies to show that maybe when the barometric pressure falls down, that excess mercury is excreted out of the mouth too. So there may be a correlation there from that aspect also.
Yeah, that could be a possibility.
Have you noticed any change if you do aerobic exercise for a period of time as far as your tolerance to the electromagnetic fields?
I do feel better when I'm exercising. I don't know if I can correlate it to the electromagnetic tolerance, but generally speaking, if I do maintain a regular exercise program, it does help.
There are studies that the exercise, aerobic exercise and anaerobic exercise do seem to bring up people's resistance. And maybe that's the reason people are getting into jogging so much, because it's the increase of all the electromagnetics.
I think there's two reasons. His statement was that there's some evidence that this increases electromagnetic or decreases electromagnetic reactivity. Maybe this is why people are into jogging. The other reason is, of course, if you measure pollutant levels on them, it comes out with the exercise. And my question was going to be, does it matter where you jog?
It matters where I jog.
Yeah, because you'll get worse a lot of times if you jog along roads or freeways with any pollutant activity at all.
You have to determine what's causing what.
That's the point. You've got to determine what the heck's going on, because you can make it worse. Yeah.
You said you were in a car accident 7 years ago?
Mm-hmm.
What type of injuries did you have? And you said, did anything become a lot worse afterwards, or something new pop up?
Okay, I had already been ill a year prior to the accident. Ill meaning the yeast infections, and with the yeast infections I would feel very spacey and have these unusual symptoms. it was a year or so after that, the car accident. In the accident, I broke my left arm. I had some oral surgery, facial lacerations. I basically walked away from the accident with nothing more than 3 stitches, a broken left arm, and some low back pain. I did have headaches, which persisted the following year, but I was not dysfunctional. I was able to work and continue. I was a senior in college at the time.
Did you hit any particular part of your head, or just your face, or the glass, or?
I did. The windshield was shattered, and there was, my hair was in it, and I was badly bruised, but I don't recall exactly which part of my head was hit. I know that an abnormal encephalogram 2 years following the accident indicated a right-sided vocal lesion, yeah. Which is where I started feeling the initial sensation on my head before the first reason I went to the physician 8 years ago was because of a dull pain to the right side of my head, and it was, at that point, it was diagnosed as stress.
We've seen a lot of massive trauma cases people who were perfectly well and had no problems, and then once they had their trauma, they were rendered sensitive to many things. There's a question in the back. Sunlight.
The sunlight.
What it does essentially is I feel very lightheaded in the sun. I can't stay in the sun too long, and I think for the most part I feel nauseated and it's just uncomfortable, so I don't expose myself more than I have to.
We've seen 3 groups of environmentally sensitive people in our center. One in which the sunlight makes them massively worse suddenly. The minute it hits them, they'll either start sneezing to get a headache or really just can't tolerate it for other reasons. Second group where there's just really no change. And then there's a third group who get much, much better the longer they stay in the sunlight, and they'll seek it out. Yes?
Have you been doing anything to either prevent or antidote your current sensitivities?
For a period of time, I underwent antigen therapy where I would have a neutralization dose to the various contaminants in foods that were most offensive to me. I underwent a program of chemical detoxification, which eliminated some detectable storage of toxic chemicals. And I have since then no longer been dependent on the antigen therapy. And so for the most part right now it's just avoidance, trying to eat as many organic foods as I can and just avoiding chemicals when possible. I have not been able to do it. There's been no relief of anything in this area. I have not been able to find anything that has helped.
Have you done any kind of meditation or
a lot of praying?
Visualizations or any kinds of things?
I haven't tried that.
You
No, I
haven't tried
haven't.
it?
Cranial adjustments.
I have tried cranial adjustments, and that offers some temporary relief. I just want to get fixed permanently.
I'm still a little confused about the relationship of the deliveries and of the trauma to the frequency of your illness.
Okay, I was considerably worse within months of each of the pregnancies. With the first one, that dull sensation I was talking about that I felt on my head, felt like somebody was touching my head. I would get numbness in my finger. Upon rising, I would feel my arms were kind of numb. This happened within 6 months after my daughter was born. And then there was a lot of the insomnia, restlessness, and that kind of thing. 2 years later, after my son was born, that's when the depression hit. It was probably within 3 days after his birth. And that's when the depression started.
How old is the youngest child?
Now, my son is 7, my daughter's 9.
And when was the accident?
A year before I was pregnant with my first child.
Now, how were you before the accident?
Okay. The yeast infection started right about when I was 19 or 20 or so, and my daughter was born at 21. I started to feel ill from the yeast infection or yeast-related problems when I was 18. So it was a year or two prior to the birth of my daughter.
Were you given any medication in your pregnancies, your deliveries?
No, with my
The second
son,
one? Yeah.
with my son, both of them were natural, but with my son, he was 6 weeks early, so they gave me some injection routinely to try to postpone the delivery. So I was actually in labor for about 30 hours. After that time, that's when the feeling of unreality kind of set in, and it really has never just left since then. I've always had that kind of a bizarre, hazy feeling ever since being in the hospital and the delivery of my son. I don't know what it was that they gave me. I'm not really sure.
I want to go back one more level. You said you had measles at 12 or 13?
I was 8.
8?
Mm-hmm.
Which put you about 3rd or 4th grade or something like that?
Probably.
Now, did you have any playground accidents a year and a half before that you can remember?
Not that I'm aware of. No.
Monkey bars, something like
We
that?
go on with what we're doing.
Yeah.
Anticonvulsants? Have you tried anticonvulsants?
I never was on that.
Why don't we get let her present her history, and then we can get moving on here.
Should I say ditto?
Barbara says her history is ditto, although you've noticed. Why don't you elaborate a few of the things that you have experienced as far as geopathic and maybe treatment with some of the machines and the like?
I have been tested on the Vega machine and come up that I do have definite electrical disturbance and geopathic zones, which I have moved some of the furniture in my home to try and avoid. I haven't noticed much improvement from moving that. I have like nervous system reactions that have been have come and gone for the last 10 years, and you were talking about a trauma. I don't think of it as a trauma, but about 10 years ago, I was trying to get well. I had been diagnosed hypoglycemic and had depressions and allergies, and with my 3rd pregnancy, you're talking about things that just hit me, that the day that my milk came in for nursing my daughter, which was like the 2nd or 3rd day, I had probably this first nervous system attack that I can remember being extreme. It was extreme agitation, and I had to pace the floor, and I can remember not wanting the baby to sense what was going on as she was nursing. And I had a lot of the postpartum stuff. I have a lot of those noises in the head you talk about, a lot of the, I hear things that other people don't hear, and they just go away. I have a lot of the stuff before storms that you talk about. Actually, even lightning, I can almost sense it before I see it. Things like I had a negative ion generator at one time that I had near my bed. It probably was placed incorrectly, but I got worse. I felt worse, and of course it was one of the first ones that came out, and who knows what it was doing, but I eventually had to give it up. And I started to tell you about the trauma 10 years ago. I took coffee enemas after 2 days of fasting on lemon and honey water, and the enema was retained, and I ended up in anaphylactic shock in the hospital, paramedics, the whole thing. And that was the start of me having these real shock attacks, which start like in my head, and they feel electrical to me, and have been hard to diagnose.
Right. So, Cyril, you want to go ahead then?
Okay. Sit all
Can
about the same
I ask
distance?
one question to all three of you? To me, you look so sensitive to everything. Have you ever experienced, how you call it here in the United States, psi phenomena, having previews?
Psychic phenomena?
Yeah, having previews or something like that. I'm just interested in it.
People tell me they think that I have, but I'm not. I don't claim that I do.
Good to hear the answer.
The first one, Giovanna said people tell her that she thinks she has, but she doesn't think she has. Dr. Calabresi says no. And you?
I think I'm sensitive.
She thinks she does.
Yeah.
You got the
I
whole
wouldn't-
spectrum.
I mean, I have not exercised on purpose.
Could you move your chair sort of back level with the other girls so you're at about the same place?
Do you want them lined up? Or do you want them...
Or about the same place.
I don't want to be too close to that.
Yes, question?
Could you move the chair down in line?
Can I ask, at this last occasion, has anyone treated her for the geopathic stress, not her home? It's my own observation that very frequently geopathic problems become locked in the body, and if they're not released, you continue to manifest the geopathic.
I still show it on the Vega, but I have not been treated, no. All they did was move things.
Oh, okay. How would you treat it? That's what I figured.
class of medicines that are described in the homeopathic materia medica as
Maybe
aggravated
for-
for a storm. So that might be something for
Could be
to
tried,
look into.
yeah.
Rhododendron, I believe, is one of the primary remedies of snow rose, but there are a number of remedies that are indicated as being worse before a storm.
Right. Well, at that stage, I would take the oscillator out and down the corridor and see whether they could tell me whether there was anything switched on or off. I can't easily do that in this situation, but if you're trying this out for yourself, at this stage you want to take it outside the room and see whether they can detect anything, and also you would question them as to whether there was anything like the paint on the instrument or any of the furnishings and so forth that they were finding were giving them a reaction. Anything else, Bill, you can think of? Okay. Yeah.
Before we begin, if any of them would report any symptoms they're currently
Yeah. Any symptoms you're currently experiencing in the room?
I'm having an awful lot of pressure, like a mold reaction.
Well,
Giovanna says she's having her mold reaction, and they ought to have a mold reaction in this room because
Yeah.
it's loaded with it.
I'm closed in and my heart's doing a little bit of funny stuff, which is what it does.
All right, so you're having some pressure feelings in your head and in your chest, and you're fine.
Okay. Well, I've set all the controls to minimum. As I say, I want to provoke the minimum possible reaction that the patients can describe that something's happened. And ideally, the doctor and the patients would be sitting where you are, so that as far as they're concerned, they can't see what I'm doing on the dials, whether the oscillator is on or off, whether I've actually repeated the same range of frequencies again, and they're merely describing symptoms subjectively and objectively.
Another question. What do you do about the electrical apparatuses in the room, the other things? Like this room has a few...
Yeah, well, ideally there won't be any other. Fluorescent lighting should be off, definitely. Tungsten lighting, well, a lot of rooms you will need some lighting.
Normally TV sets would be off, and
would you say whether the instrument was on or off? Nothing's changed. No change. Right. Well, that was. I usually start at about 1 hertz, 1 cycle per second, and if you go much below that, it gets very tedious. And at the moment, it is whatever is happening to leak out of the box. There is nothing connected to any of the terminals. There is a power cord coming out of the back. The instruments are usually not designed to be so perfectly screened that nothing will leak back out of the wiring and through the joins in the case. And I've got it set to the minimum level that I can set it to, and if I alter the level, for example, I think, Bill, if you can watch the subjects and get any descriptions of any symptoms and sort of shout as soon as a symptom comes. Yes.
I hate to take the time, but what might be nice is if you move that box, move yourself to the end of the table.
Right.
Move forward into the light, and then the camera can see what you're doing over your shoulder.
Okay.
Hey, you're a showman, eh?
Go ahead.
Are there any times or any conditions or occasions where your teeth hurt? What are those?
I used to have that before I underwent any therapy.
Giovanna used to have that after she underwent, before she underwent any therapy. She doesn't have it now.
I don't know.
She doesn't know.
But I don't have that.
We've observed that the people, that's one of the indications we use where the fillings might be a problem if they continue to have recurrent mouth pain. But the second thing we've noticed, if you lower their total load, The majority of those go away, and those that don't may have a problem. I can't really tell you. We measured a lot of things, but I can't. I don't have anything.
Probably along the time when I'm not feeling well otherwise. Yeah, yeah. Mine are all nervous systems, so I can actually sense something going between my teeth. I'm feeling less pressure in my head.
All right, Giovanna is feeling less pressure in her head right now than she did a little bit ago. However, she has moved.
Okay, we've got two reports now of some changes. They don't know, I think, whether I've done anything to the box. In fact, what I have done is to turn the signal level up by 60 decibels to the maximum output with nothing at all connected to the input of the box. I think the lamp's having problems too. So that is probably as good a place to start. I'm not going to plug the pigtail in because I'll try changing the frequency and see whether there is any change of symptoms reported in. So tell me if you feel any different.
Worse, but I have a delay reaction. It could be from what
Barbara's a little nauseated, feels a little worse. She's not sure where it's coming from. The other, are you holding? You're feeling better? Or?
I'm not sure, but I'm kind of feeling like my head is burning.
Perhaps Giovanna's head's burning. Not sure. Dorothy's the same. It's okay. Yeah, that's particularly the front row, huh? We'll find out, won't we?
All right? No change?
I'm not good.
You're not good. Well, I have advanced the frequency now slowly, and I've gone from 1 hertz, where it was set when things, first reports came, and the next report came at 1.5 hertz. It's now 2.2 hertz, so that this, in this sort of frequency region, a few tenths of a hertz can make a difference in the symptoms you get, and this should give you the sort of feel for the speed at which you can do it. It does have to be an interactive testing with the subject to try and... Okay. Okay, well, I've got to...
Can you neutralize her?
I've got to go on now, and that was at 2.5. I'm going up. Whether the other ladies, if you do you want, you're not reacting at the moment. You are. That is that's the loudspeaker going.
We're getting audio feedback.
I can hear it. 3 hertz. I'll have to go up, Bill.
Okay, go ahead.
I've taken that back to 1, and there was no relief, so I'm going to go you don't want to stop too long on the regions where there is a reaction. So. Now there are. That was 5 hertz. Now there are. How's that?
I just feel really nervous.
Okay.
I can't stand it. Is there anything else we can do?
No.
God, I
Tell
can't
me.
stand it. My fingers are shaking and everything. Can you go back to where we were before we started?
Okay. Try that. How's that?
It's a little bit better.
Okay.
I'm still tingling.
It might take a minute or two to wear off. I've gone back to 1, and I've.
Anything that could, to totally neutralize it? Yeah, even vitamin C or sulfur gold or something that helps.
Yep.
Is there a possibility of a neutralization factor can put around between 7 and 10 hertz, the alpha frequency of the brain?
I've been up through that one, and there wasn't. Okay. I've been up to just over 10 hertz, looking fairly quickly for a neutralizing point. You do, if you possibly can, at the beginning of testing, you do want to try to find a neutralizing point as quickly as you can, so that if you do get a reaction, then you can go back to it and give the patient some relief. I mean, this sort of thing it is much easier to do it by changing the frequency of an oscillator than trying to get rid of a skin prick injection test.
I've experimented and I found a frequency between 16 and 17 hertz that sometimes can be helpful.
Is there a possibility of she's over some sort of geopathic stress right in that seat? They all experienced a little change from the back to the front?
I suppose it's a possibility, yeah. But she clearly has had a change when he decreased it and went it up. I don't think there's much question about that.
I'm back at 1 hertz.
She, when she moved up, we didn't know whether it was moved up or he had turned it, but she suddenly felt better, and I think it was probably when she felt better there. Then as he went up, that's when it really got her. Yeah, she's getting tired now, so
that's all right.
Probably going to withdraw, and that'll be all right. Your energy's all gone, okay.
Her energy's all gone.
Right.
Never try holding this in her left hand.
I feel so weak, though.
Left hand. Left hand.
What did you give her?
I want to know whether it does any good.
I'm getting a lot of burping, which is something that I
A lot of?
A lot of burping, which is something that I get when I get this.
She's getting effects typical of the attacks, but doesn't feel like talking.
Dr. Smith, the obvious thing is that the psychiatrists, regular psychiatrists, would have conclusions about this particular demonstration. I wonder if you could address some of those.
We can get Bill to.
Well, conventional psychiatrists would have certain conclusions that would be considerably different than your impressions, and I was wondering if you could address some of those.
I can't address them. I'm not a psychiatrist.
Can you suggest people into these reactions when you use the oscilloscope?
Yeah, definitely.
Okay, so that's
Yep.
I think we know Manny when somebody else.
Yeah.
Yep.
Mine wake me up in the middle of the night after cold sleep. Now, psychologists could figure that out, but there's no dreams they've had before.
She's getting a little better.
Okay.
Does showering or any kind of grounding phenomenon, like walking on earth and bare feet, improve reactions on either of these things?
Showers will help. Yeah, showers will be great.
What I did, I handed her a diode, and the diode takes to it some of the electrical energy.
Can she try it?
Would you try a crystal?
I've got
Yeah.
one. She's
Okay.
She's coming out of it, but she can try that. You look right.
Yeah.
Does that make any difference?
Women in the left.
She Yvonne says she's going to sue me for makeup that's all over her. I think she's coming out of it okay now.
Okay. Well, I have now moved it down to 0.9 from 1 to 0.95, and that seems to be better. It can be as sharp as that. I have been right through a very sharp reaction within 1 hertz. Good. Thank you for your demonstration.
Yes. On the previous discussion this afternoon, mention was made about trying a 50-cycle current to neutralize this. Can that be done?
We have, I think the ones I was telling about were American patients who were provoked on 60 cycles and neutralized on 50. But and apparently the Europeans have been provoked on 50 and neutralized on 60.
Yeah, I've tested people in London who have spent most of their life over in the States, and they were okay when challenged with 50 hertz, but they showed a reaction at 60 hertz that they carried with them.
But that, there's obviously a whole spectrum of other people who are triggered off at other cycles and also perhaps neutralized with other cycles.
Yeah. But you see, a professional musician can very often remember absolute pitch, so the fact that the body can remember a frequency is not any more remarkable than that.
You made reference to taking some vitamin C or bicarbonate of soda to neutralize a reaction. That's a common thing that's used for food allergy or inhalant reactions. Do you find those type of orthomolecular supplements to be helpful for electromagnetic reactions as well?
Barbara says doesn't help.
I have a few things for emergencies, like when I can't think.
VH used to help me, and I figured the only thing to be was all the minerals.
We have, in the environmental unit where we had them under control, sometimes we find IV vitamin C will stop them. And it may be that, I don't understand about whether the waves create free radicals or not, but if they do, well, then you could explain it very easily that those would work. Yes.
Could there be a homeopathic made now of that frequency and give to, we saw one patient that is recovering. Barbara, how are you doing?
I think I'm feeling a little better than I was a few minutes ago, but this room is definitely closed in.
So there could be something that would make her better, make Barbara better. So is there a and Doctor also, could there be a homeopathic made and duplicated on a piece of tape, or magnetic tape, or even water and alcohol?
Well, I mean, the numbers on here are all you need.
Well, that's what I'm saying.
Yeah.
Yeah, but they can't obviously keep a machine on their back.
No, but you can pass the output of this through a solenoid and put one of those tubes that I showed you with water that the patient tolerates, either water for injection or spring water that they tolerate, and then you can check it with them beforehand, and as long as there's no reaction, you can put it in the coil, and I usually leave it for about 5 minutes in a field which is sort of greater than the Earth's magnetic field, and leave it to cook for 5 minutes, and then give it to the patient, and you can put those in the mail and send a repeat.
But the one problem with them that we've seen, they don't hold.
Yeah.
What the other symptoms that this patient had, the history. I mean, obviously she's feeling better now. Is she going to feel, if she had a homeopathic at that particular frequency, is she going to feel exactly the way she feels now as long as the homeopathic lasts? Unless there's a, you said a traumatic experience would happen. Is that
my experience is that if you the output of an oscillator like this and a tube of charged water are interchangeable.
How long does that charge hold on?
Well, Bill finds it not very long. If the patient we find isn't sort of reacting very strongly very often, that the tube itself will start, and we have done a controlled experiment in making up several tubes and giving them to the patient with instructions to keep the others in the refrigerator and not to use them. And then when the patient reports that the tube has died or been drained, as the phrase they usually use, we've taken all 3 tubes back and relabeled them double-blind, and the patient could pick out which tube was which, and the other 2 were still okay.
We're talking about therapeutically. I just haven't seen them hold over a half hour most of the time. Pardon?
If you freeze that water, does that lower its
I don't know. I've never done that.
With the chemical allergens, they're normally stored in the freeze, and they are effective while they're frozen, and they're and the patients hold them to thaw out. They react or otherwise while they're doing it. So we haven't done enough trials with the magnetically treated water to give you an answer on that one.
Have you tried anything else besides the water? Have you tried...
Saline?
No. Magnetic tape from a reel-to-reel tape, demagnetize it, put the imprint on there, and then put it on the patient?
Well, that wouldn't give a frequency. It would just give a steady field. It would behave like a permanent magnet. You've got to move the mag tape in order to generate the frequency. You could probably do it if you panned your hand over it in the same way that that's what a dowser does. Yeah.
As to whether you or anybody in the room has worked with people with these sensitivities through self-regulation, biofeedback, breathing, where you would expose them to these sensitivities and have them try to regulate themselves with the phobia.
Has anybody tried biofeedback with these patients? Bill, have you?
Yes. We have a large program of biofeedback in the hospital, and most of these people have had it beforehand, and it's not worked at all. But once you get them unloaded, a lot of times it seems to help. I've never seen it cure anybody, but what it does is blunt reactions.
But like, as we were doing here and exposing Giovanni to the sound, it seemed to me it would be possible for her to learn to know when the reaction's coming on.
Why do you say that?
Well, it got worse.
Well, you mean she could perceive that something was starting. She did perceive that.
And whether there are things that she could do either through biofeedback or without biofeedback to begin to change her breathing and reverse the stress.
Well, I think she tried that, but I think that it just overwhelmed it. And we have never seen it stop a reaction under controlled conditions, but we have seen it blunt it. Yeah. Yeah.
Well, Bill says his only last half an hour or more. I was just saying that we have given patients several tubes to take with them with instructions to use one, keep the others in the refrigerator as controls, and then when they say that the tube that they've been using is drained, is the word they use, is not alleviating the responses anymore, they've brought the whole lot back, and we can relabel them and give them double blind, and they can tell which tubes are which.
Can you test them after they come back to see if your instruments say they've lost the charge?
Not as such. We do retest. I mean, we've followed some patients for several years, and some have held their frequency neutralizing exactly, and others have drifted slowly. And perhaps a few percent or more each time they've come in for testing over more than a year.
Dr. Smith, if you just simply were to, I know what you've done now and what you usually do is look
Yeah.
at a neutralizing frequency to calm the patient back down or
Yeah.
to give the patient some euphoria.
Yeah.
Or whatever.
Well, no, you don't want to leave them high either.
Yeah, but let's say in the balanced amount. If you just shut the oscillator off, would the patient return to a normal state?
Not necessarily. No, I have as I sort of indicated, I do sort of play tricks in the sense that I don't necessarily sort of go smoothly through the frequency if I feel that the patient may be reacting to other things, and I have instead of changing the range, I switched the oscillator off, and the patient has suddenly turned around and said, "Who touched me on the shoulder?" No. You really need a reference phase, and some oscillators you can do a phase shift. This one you can't, and the ones I use you can't. It's usually done with what I can borrow for free from the university. And I put them in a car and drive 200 miles down to London and see the patients that Jean and Ray Choi produce for me there. Oh yeah, yeah. But I think that is a point that I make there is rather more important, because equipment like some of these electrical testers that were being described do take the patient's own. I don't think it's clinically allowed to do that. Sorry, what was I saying? Yeah, take the patient's own oscillations, and they do phase invert and feed back. Now, if instead of putting a phase inversion in, you put a phase shifter in, you are clearly, since the thing works, you are clearly able to break into the patient's regulatory control loop. Therefore, if you can measure the gain and phase that you are injecting and use the patient's response, you have the potential for measuring the Nyquist-Argand diagram, the mathematical theoretical control system chart that will tell you how near to the 1-0 point you are, what stability margin that regulatory system has got. And once you can do that, you can quantify the particular regulatory system for that patient, and you've then got graphs and numbers, and we're, I think, as near to getting that going as one can be if you get hold of a system and modify it to be able to do that plot, preferably automatically. So anybody wants to write a good funding application, that's my suggestion. Well, who came first? Yes.
I'd like to mention the fact that in the last 10 years or so, we've trained approximately 3,000 people in our biofeedback and psychophysiology center. We have a lot of people that have these kinds of symptoms, and many of whom have had asthma. And we are beginning to believe, on the basis of their successes, that human potential really is much more powerful than the carcinogens and the environment, and that the best way to avoid cancer in later life is to learn how to go down into a state of deep relaxation and do that 10 minutes every day. And that the human power of self-regulation really is the crucial thing if we want patients to be free of their symptoms years down the road.
Well, that seems to make sense, doesn't it? If you exercise the muscular system and the muscular regulatory system by exercise, the exercises of all the other regulatory systems would seem to be the natural thing to follow.
Because homeostasis in the hypothalamic and pituitary region is what we're really training. You're not training the body. The patients think we're training the body, but obviously you're not. You're training the central nervous system and the hormonal system.
Thank you.
Yes.
Yes, I'd like a comment from you and from Dr. Rae as well as to whether or not such reactions of this might be a factor in occupations that are critical, such as, drivers or aircraft pilots or things like that.
Yes, and I think the airlines are also quite worried about the number of people that have heart attacks in the passenger part of the aircraft. Apart from the number of No, not until they fly into a mountain. That has happened. Yes. I think it's more than a possibility. I think it's happened.
Yeah, I think one thing you have to remember, the airlines have a beautiful natural selection system. And I think the reason there aren't more of those, both chemical sensitivity and electrical sensitivity, is just by their natural selection, the way they select pilots and the certain things they have to do. For example, they have to do a lot of test passing on fine-tuning, and the environmentally crippled patient cannot do fine-tuning, and therefore they bail out. Now, if you want to take airline stewardesses, I can show you hundreds of them, thousands of them, because they don't screen those people. And they certainly have it. There's a ton of them that have that. The pilots seem to be a different ballgame for that reason.
Yeah, but there is.
I understand that, but boy, there's a lot of stuff come out of simulators.
But there are further things. You see, occupationally, the airline pilot is in a hydrocarbon vapor environment a lot of his working life. I have talked to pilots, and they say that as far as the microwaves are concerned, in Britain it's a lot better because you're not usually kept out on the perimeter in the beams for more than a few minutes waiting for takeoff, whereas in the States, when there's a long queue for takeoff, you can be out in the radar beams for half an hour or more. So that once you get away from the... You saw the chart I put up. There are radars all around the place, so that is a way of acquiring an electromagnetic sensitivity. Once you start reacting to the hydrocarbon sensitivities, the plastics in the aircraft, and then also on aircrew, particularly that fly long distances, the risk of junk foods during the flight and at hotels and so forth at the end of the journey, and they're losing all the way along.
Airline pilots have a 5-year shorter lifespan compared to the average male. Also, do dentists.
That may be due to their adaptive phenomena, where they can cover up the disease process and not have overt symptoms, Yes. Yeah, but we can't neutralize her until we get this one out. But we can take her out.
We see someone who had a very sort of reaction with more characteristic of beta brainwaves with a frequency that's somewhere between 1.5 and 2.2 hertz. Which should, if there's a brainwave entrainment phenomenon, cause the patient to fall asleep, or go into some sort of just the opposite state that we would expect. So I was wondering, does anyone have any thought on what the possible mechanism of action is?
Bipolarity phenomenon, stimulatory withdrawal phase. Everybody's different. His wavelength that he was talking about.
Is it possible that this sort of low frequency information is suppressing some type of low-frequency information in the brain and allowing beta rhythm to predominate and produce that type of anxiety reaction?
I think you're going to have somebody smarter than me to answer that one.
Has anybody done a correlative study looking at the person's electrical energy, measuring their brain waves, their skin potentials, and whatnot in relationship to the oscilloscope or this generator thing, and correlating that with symptoms? In other words,
nobody would believe that this sort of signal level will produce any effect. Nobody would have thought of trying it.
Yes, it has been done, but not for this type of situation exactly. And that's, I'll give just the name. It's Professor Rauscher and William Weiss in San Leandro, California, have consistently done the work of watching at an external ELF signals and how they can be picked up in the brain at the same time. But my only observation that might be of interest is the reason why would your hand shake? And
Speak up, please.
That might be a problem in the neural system, which is known to be provoked by external frequencies.
The statement was that the handshaking he couldn't understand, and he was postulating this might be a neuron phenomenon.
By many things.
Yeah.
Why would hand shake? And I thought this would be a response that can be related to epilepsy.
We have about 10 patients now on film that get tetanic-like reactions in that their whole body may go into tetany.
I can show you one on the videotape later.
One side, yeah. And clearly those people can be turned on and off with that. And it's interesting that some of them can be turned on and off with intravenous magnesium.
Because normally in homeopathic, the magnesium would clear the problem.
Is that right?
If you took magnesium, you would have shaking hands. That's an occupational problem. The thing is that you take magnesium phosphate, you will stop having any spasmodic activity.
Question from by the door, last one.
I was just going to try and make sure I'm understanding what we're trying to do here. We have the generator where we have a certain wave signal which will trigger some type of reaction. Then we're trying to find a neutralization signal for that. And by doing this, we're going to desensitize to a host of allergies. Is this how, or is there more?
Not necessarily, no. The sort of use that I can be to the clinic in London with this is that where they are having problems with multiple allergies and the patient is starting to react electromagnetically either to the environment or to emissions from other patients during group testing, then if we can at least neutralize the electrical one, then they've got some hope of being able to make sense of neutralizing the nutritional and environmental factors. Very often, if they do get the nutritional ones under control, then the electrical problems disappear with them.
So using a monitoring device too, then, and how they do it on a chemical level too, then.
Well, not as monitoring so much as an aid to sort of an intractable case where they're not making progress.
My understanding is to say that when you give the neutralizing frequency, it does not help their chemical sensitivity at all.
It's an awkward one.
It's not all or none, but I don't. Yeah. I think usually probably not. We haven't found that yet.
Okay. In other words, you're not relying on.
Except on her report that when she had her MRI, she was okay for 2 days. But we've not been able to achieve that with the other patients. It would seem to be somewhat distinct.
I mean, you could try challenging with a smell while their neutralizing frequency was on, which they happen to describe as corresponding to that particular smell, and see how much interaction there was. But whether you could do that easily in a clinical situation, you have to find the right patient.
Yeah, the other part of my question was, like you alluded to earlier, around 200 meters, the waveform electromagnetic pollution can affect somebody adversely. I guess after that, it is inversely.
Well, that's the electric field. Magnetic field could well extend much further than that, but it's a question of what they happen to be being triggered by.
Okay, what about dwellings in various houses like steel or frame house?
Stephen Perry, that did work on suicides near overhead power lines, is now in retirement and is looking at tower blocks, so that he takes each floor of the block and looks at any sickness referrals on that floor of the tower block, and he's finding that there is a very marked incidence or higher incidence of sickness where the power riser goes up the building.
If I can, just to show what's going on with power lines in this country, I don't know how many people read about Houston. I think it was Power and Light Company was sued for $25 million successfully for having power lines going across 3 schools.
Yes, I read about that. It reached England.
I did.
The world is sort of having problems, but at the moment it's not prepared to grasp them. I'm afraid too much money and too much defensive research, I'm afraid. It's not realised as an overall environmental problem, and it's everybody practicing the equivalent of defensive medicine in their research labs.
And also, quickly say, you said that 0.4 watts per square centimeter could generate cataracts. I believe that was the figure.
You've got to get all the other conditions right. Microwatts.
Microwatts.
That was the threshold for one particular set of experiments in vitro in bovine eye lenses.
Well, my understanding is that these cellular phones generate 1 watt per square centimeter around the face level where you're holding them. So that's a lot more. The different frequencies.
Yeah. It seems to be a question of frequency and coherence that matters. I mean, if you've got a technician who is setting up microwave oscillators, and a lot of these have magnets associated with them as a part of the works, then his head will be moving in and out of the field while he's in the frequency, so that at regular intervals through the working day, he will be satisfying certain resonance conditions. And as you saw in the slide of the yeast cells, that it will break up pearl chains, and one of the early stages of cataract formation is the breakaway of cells around the equator.
In Japan is what's been defined as a magnetic field deficiency syndrome from living in high-rise buildings, being out of touch with the natural environment. I was wondering if any of these people had made any use of magnetized jewelry or any type of thing like this to try and combat this electromagnetic sensitivity.
I'd have to combat my husband first if I brought the magnets, and then if you let me do that, I would consider it. I mean, realistically, somebody did approach me recently with the possibility, and it just, I guess, it doesn't have a real favorable connotation. I guess I don't understand it well enough to have implemented it myself, and I guess if I'm convinced that it could help, I mean, I would probably try it. I just don't understand the phenomena that well.
How do you get the right frequencies for you? With
Well, no, these are permanent magnets. It's not a chain. There are rare earth magnets about 1,500 Gauss strength that are worn in a necklace or bracelet. And
the person who presented it to me was wearing a pyramid on her head.
No, that's not quite what we're doing.
That's why I said
Giovanna, it's TDK who produced a bracelet. It's gold-plated, and you can wear it around your neck.
Looks really nice. Doesn't look like getting it.
That's what I want for Christmas.
If it helps everyone,
I will consider that.
Are these patients sensitive to magnets in general?
Uh-huh.
Can you say what your reactions are to permanent magnets?
I just got some that are supposed to go on my water system, and I had them on my desk for a couple days until I took, and it just didn't occur to me they were hidden under papers and things, but I just felt sort of funny when I went by them and agitated a little bit.
Well, then you shouldn't get them.
Oh.
Well, I mean, walking past a permanent magnet will be the equivalent to a very low frequency.
Yeah. And also, depending on the north and the south poles, there's been research done. One pole is going to have a certain effect on the physiology, and the other pole is going to have a different effect. So.
I went to a seminar about this years ago and bought some, and I had them in my house, and I had them close to my bed actually for a while. And after a year, I said, "This is stupid. Maybe they're not. Whatever they're doing, they're just sitting in the drawer." I took them out and put them in the garage.
Yeah.
And
I don't know which is north and which is south.
You put in a bowl of water on a cork, and the south side will go to the
Are there
north
any
pole.
specific frequency bands that you find are more likely than others to produce this type of noxious reaction?
No. We've,
It's just as likely for someone to have a reaction, let's say, in an alpha frequency band as a beta or anything else.
This sort of pattern will go on right up into the microwave region. If you there is usually a succession of neutralizations and aggravations, and eventually you find one or two regions where the neutralization is best. All the symptoms go at the same time. It's no good curing the headache when there's a pain in your leg as well, and then if you cure both those, you may get.
In your clinical work, do you go through the higher spectrum from sub-hertz into gigahertz?
I don't usually go sub-hertz because it just takes a long time per hertz. So I start round about 1 hertz for a sort of heartbeat sort of frequency. Depends on the oscillator I'm using, and then if I go and find some nice clearly defined neutralizing points, then I stop at that. And because if you go on and you start to provoke sort of delayed responses and long-term things, you can be left with the problem that will take an hour or a day to clear up.
Do you find that if a patient has multiple reactivities to low as well as higher frequency emissions, that the reactions tend to be worse in the lower or higher frequencies?
Usually, if you switch on the oscillator and you get a reaction immediately, and you just don't get any neutralizing at all, then you just have to keep going, and either neutralize chemically at the end of the range of frequencies available. But that sort of thing is the patient I showed you, with the extended chart, neutralized on about a dilution 300 at that time, and there was the first amelioration of any sort, rarely, was in the 100 megahertz region, and there were 1 or 2 neutralizations there, and then the one that held was at 512 megahertz, plus or minus 3. Yeah, you could tune it by the flickering of her eyelids as she came out of second stage anesthesia. It was as sharp as that.
To answer your question, I just found out that I was sensitive to magnets. I just was sharing with Dr. Rae that I have not been able to tolerate telephone.
She was sensitive to magnets. She couldn't tolerate telephones for the last 10 years.
I guess I really didn't know that there's magnets.
What about battery-powered things, wristwatches?
I've never been aware of it. That's not to say that it doesn't work. I've always held the phone like this, and just because I'm so uncomfortable with it close to my face.
There is a problem with deaf children that we're trying to tackle at the moment, and maybe you can help me, because we've had it with one deaf teacher that had problems after wearing a radio mic for about 10 years, and she was better when she put the radio mic on the desk in front of her, but the problem with deaf children is that you can't communicate with them unless you blast the sound in with a pair of headphones, and once they start to respond unfavorably to the magnets in the headphones, you've got problems. And the solution that I can see is that you want to give them something like the headsets you have in an aircraft, and I can't find out who make them, and there's no good asking the air hostesses, they haven't a clue, and I've tried the aircraft manufacturers, and they thought they had one around, but they can't help. But anybody who can come to me afterwards and tell me where I can get one to try it, I'd be very grateful.
Question, have you ever triggered an epileptic seizure or deep ball using the frequencies like that?
No.
Never? Okay. One more question with the clinical aspects of these patients and other ones. Well, I'm picking up basically, and what I'm looking for is something I'm kind of remodeling in acupuncture a little bit right now. Is could there possibly be a common denominator where meridians were damaged at one time through either clinical illness or an accident? That's why I was asking challenge her as to when she had it, and then it got aggravated later on. And young kids are constantly falling off and bumping their heads and stuff like that. Like you say, you have trouble putting the telephone by your ear. Is that true for both sides? I suspect not. I suspect one side's worse than the other side.
My right side.
And which side did you have? Did you think?
The injury was on the right side.
Yeah, and again, from other research I've done in acupuncture and especially the modiometric machine, which just measures the meridians, is that I've seen a case, or the doctor running around here right now, I'm not sure he's in this meeting, who has shown me a clinical case in which a person had a very major physiological problem that was caused by a pinched off meridian in the head, and it took a cranial adjustment to fix it. You had temporary relief from the cranial adjustment. I would suspect you have damaged meridians. And what's happening with the meridians is that you get the adjustment, and then your head is starting, after a while, so it starts falling back out of whack again. If this is true,
then again, the model I'm coming up with right now would also explain why the fluids would block it. I suspect if you were to take your experiment and put her into a real heavy, tense mode and just immerse her in a tank of water, the problem would go away that quick.
Well, one thing we've seen is sightedness. Sightedness in most environmentally sensitive people have sightedness. That their pain will go all down one side, or their reaction will all go down one side. And the question is that a meridian, or is that the sympathetic nervous chain, which goes right down that side, or is it both?
I think it's tied more into the lymphatic system. That the actual meridians, if you go back to, and this is something I just recently learned, go back to the true definition of what a meridian is, which is misnomer. The Chinese translation for it are canals, and the Sioux points, the direct translation, are wells. And they did talk in cryptic forms back in that days, but I suspect they really did mean canals, fluid. The reason people cannot find the meridians is because they're looking for a string, they're looking for something esoteric. It's not, it's fluid. That's the reason you can have a surgery and not kill somebody by going through the meridians. They self-correct upon healing. They self-realign, maybe.
There's a Dr. Takashi in Japan who insists that the acupuncture channel system is nothing more than a transport system for sodium ions, and uses extremely low dilutions, a 10 to the minus 9th dilution of sodium hydroxide in lieu of acupuncture needles.
I've got a videotape. Can anybody change over the monitor leads for me, please?
Just hit play. It'll come up.
Hit play and it goes, right?
There you go. There you go. You're coming.
Now, this is a tape that was made by with Dr. Choi in London, showing the testing of a subject. I'll give you, you'll get some of the case history, but this just shows the topical testing with the drop of allergen on the thing. And this is, the first is just a run of the tubes that you need if you go in for serial dilution, and that is the neutralizing procedure for going to about 300 dilution.
Would you give us a brief account of the medical problems?
Well, now I know more about it. I know that it started well into my childhood, but I've actually been ill for the past 6 years. I started with conjunctivitis and sinusitis. Then I got very severe migraine, which I'd have 2 or 3 attacks each week, in which I'd lose complete use of my legs, and I would get to a state where I just couldn't move. I'd just been laid flat out, very dizzy, and headache, and all the usual migraine things. That carried on for a number of years, and at that severity, I had all sorts of treatment, different drugs. Nothing worked until finally somebody suggested avoiding certain foods. I tried that, and immediately the migraines became less frequent. So then I had about a year with the migraines every couple of weeks instead of every couple of days. And then I started very violent sneezing. One day I woke one morning and sneezed, and all day it carried on getting more and more frequent. The trigger, we think, was pesticide sprays. It carried on after various treatments of different kinds, including lots of homeopathic remedies and acupuncture and hypnosis, and all, as well as different drugs. And also a stay in a clinic in the French Pyrenees, where the air is supposed to be clean and pure. That was the only time I had any respite from it, because I was much better up there. But immediately I came home, it started just as bad as before. Then I came here, and since then the sneezing has become much less frequent. And although, providing I keep taking the drops and continue with it, it seems to keep it at bay. But when I stopped it, it did return.
Just relax and let your hand fall. Right. How do you feel, Lisa?
If it's on the skin, you can change very quickly.
What was it you put on?
It's a mole.
How are you feeling now?
The abbreviation is CLAD-HERM.
What are you feeling?
It's weak.
Lisa, how are you feeling? Lisa, would you like to lie down? Let's go to the next one.
This is a run for the television cameras with a girl that's been tested a large number of times. So that the questioning in the video there is for the purposes of
No,
the
there won't be
camera.
any more. Put about 15. Number 15. Yes, all right.
People can't neutralize with injections. You can't neutralize them under the tongue. And it just blew my mind when I saw her dropping this on the skin, and I said, that, it doesn't work, But I've got two patients now that I've followed for 2 years that it's been fantastic for them. And they get their neutralizing doses on her.
Doing that 3 or 4 times a minute, day and night.
How are you feeling now?
You can get around there now, you're all right. You're the same. You're within the distance of it.
Can you lift your legs up? Can you lift your legs up? No? Can you try to move your toes? As you can see, the legs are very stiff. Can you bend it? No, it's all right. No, it's all right. No, I just want them. It's all right. No, I just want to pull them. Can you move your toes, Lisa? Can you move this hand? Can you move your left hand? Can you lift it up? Lift it right up. Can you lift it right up, Lisa? All right. Let's go to 50s or 60s. Let's go to 60. Lisa, can you hear me? Can you move your left hand? Can you lift it up? There's a level of demarcation in which the temperature is different. On the right leg, the level of demarcation is just above the ankle. It's about 2 inches above the ankle joint. On the left leg, it is just below the ankle joint. Okay. Yeah. So we have to jump up to 200 to 300. Jump up to 200 something.
Sound of a typewriter. Had patients when
It's
the
all right,
goes
Lisa.
past, they throw themselves
It's all
on the
right.
bed. You have to catch them.
Put it on the leg. Yeah. It's all right, Lisa. It's all right. Yeah, 350, 360, and then she go to 400. Lisa, it's all right, Lisa.
Yeah, that's that stack of tubes. Yeah, that's log 10 beyond Avogadro.
It's all right, it's just a typewriter. Lisa.
That was way up the building. It was acoustic.
Oh, acoustic?
It was. It'll be a mechanical typewriter.
Can you use any skin surface for the application?
Yeah. It's a whole body effect. I think he does. Later he does put one on the leg. I think. Yes, because it was being filmed. So he didn't start too far away, but
So
enough to provoke the reaction.
So the 350 was what she needed for neutralizing?
No, it hasn't got there yet. It's around about 360, I think. But
in other words, he gave the 350, but there's no
Please,
reaction. Will the reaction?
are you feeling better?
Will the
You've been hit on the head. Can you move your legs? Can you move your toes? Wriggle your toes? All right, no, let's have the next drop. Show this one. No, let's get ready for the next drop. Yeah. The line of demarcation on the right leg is now just above the tarsal joints. And it's the same on the left leg. Can you wriggle your toes? That's very good. You can just about move your toes on the left side. What about the right side? Can you move them at all? No. Okay, let's have the next one. Okay. Toes are moving now. The right big toe. Have the sensation return in your right foot. It's coming back, is it? Okay, Nola. Can you lift your left leg up? But the right one is still very stiff. Can you feel that?
Yeah.
You can feel it now. What about this one? Plantar on the left side is now going. It's the same on the right side. Can you lift this leg up? Just a little bit. All right. Okay. It's all right. Put it in your hand. Yeah, only when you're ready. Not before that. I'm just going to do. You want a couple more? Let's try another one more. Yeah. How do the legs feel?
It's still a bit creepy. I don't know if we're back to as they were this morning.
Do your legs feel heavy?
Yeah.
Can you lift them up like that?
You can't do that, the best you can.
All right, let's try and see how high you can lift them up. Let's try the other one. Okay.
That hasn't gone.
The wheel, as you can see, is soft and it has not grown at all. The edges are not raised and it's not flat. So this is the neutralizing wheel, and the number is 5. What is the number? 578. So the neutralizing point is dilution 578. How are you feeling now, Lisa?
A bit better.
It's at that end of the film.
Can you just...
When are you going to be replaced?
Good. I wish I could be. It's a very much of a labour-intensive job. The problem is, you can scan frequency, but you really do need an operator, as you can see, that will watch the symptoms and adjust the frequency at about the speed at which the symptoms appear or don't appear. And I've given some thought as to how you would automate it, because it is very labour intensive, and it isn't a thing you could think of doing routinely. And it depends on the symptoms. You see, if it's something that the patient can
I mean, if it could be calibrated even less, where the symptoms aren't so dramatic.
If the patient goes flat on their back, there's nobody to turn the machine off at the wrong frequency.
What about the use of multiple frequencies or white noise type of information? Have you done any work with that?
I do sometimes use multiple frequencies, sort of cocktail. Sometimes I find that when with all the oscillators I've got, that I can't really get a good disappearance of all the frequencies, and I take the best one, and then I try adding the next best one from another oscillator, and so on. So that sometimes I do finish up leaving 2 or 3 frequencies on, and that can help. And of course, you can superimpose the frequencies on the tube of water by putting one in after another. But again, I tend to try to give them several tubes and to get them to try to rotate them, one sort of as rotating a diet, so that they don't acquire a reaction against that particular tube.
And how long is your exposure of the water for?
This is purely empirical. I tend to give it somewhere between 5 and 15 minutes, depending on how busy things are going and what the queue is like outside.
Do you feel that migraine headaches in some patients could be caused by these frequencies?
Yes, I've had patients that have been told that it's all in the mind and it's their fault, and that I've been able to take a box like this and turn on and off at will headaches that they've had for 20 years, and that they've if you can't. To comfort always, if you can't do anything else efficient by neutralizing the patient, you can at least give them hope that the thing can be turned on and off by something outside themselves. That is a sort of a good start.
There's a study apparently undergoing in the U.S. Navy where they're using shaped frequency magnetic pulse fields at certain frequencies that can change normal cells in a agar solution into leukemic cells, and by changing the magnetic field again, can get the leukemic cells to go back to normal cells. Have you heard anything about this?
No, it hasn't reached me. Some things reached me on the grapevine, so to speak, but I hadn't heard about that one, and I don't know if Dennis has. Is he still around, or?
Well, were you mentioning Paul's work today?
Yes, yes.
Well, apparently his work is what they based the pulsing magnetic fields to coalesce cells together.
Yes, that's Zimmerman as well, and you can do cell fusion. Yes, we have tried that, and erythrocytes are easy to do. We tried to do it with yeast cells by taking the outer coating off with helicase enzyme, and we got them to go together, but they sort of came apart again. Dennis, query there about. Do you know anything about U.S. Navy work? Can you repeat the question?
Using shaped magnetic pulsed fields at certain frequencies to change normal cells in a agar or some type of solution into leukemic cells, changing the field and changing the leukemic cells back into normal cells.
I didn't know about that research on the Navy. I know some research that they have problems with their rockets coming out of those and these things, the light coming out of the algae, the sea algae. Those Polaris rockets are, at least if I understand it correctly, are directed by laser things and so on, and they have problems with the light coming out of the algae. That's what I know from the Navy over here.
Is there any orientation of the field to the patient that makes a difference? If you align the spine or frontal or coronal or whatever?
It's usually, as you can see, the patient is a long way away. Where I have tried, it does seem to be sort of upper abdomen in general area, around, if you try to be directional with it, but usually one's just in sort of whole body environment.
So it really makes no difference whether the patient is sitting or lying down when you administer it?
No. They're sort of that distance away. That's on one side of the room, and you can see that if somebody's sitting there and you've got a patient, usually on the bed, because then if they do feel they want to put their feet up, then it's much easier that they're on the bed than having to sort of help an immobile patient from a chair across to the bed.
Do you have a reason why with like hears like, why a different frequency is pulling her out of it rather than the same frequency?
No.
Any construct that you might have?
Not at the moment. I mean, one is dealing with the regulatory system, and to have a construct on that, the argument that I gave earlier on, that one needs the sort of equipment like the Mora system with a variable gain and phase, and then once you can start to do the Argand diagram for the regulatory system, then you can begin to put it into numbers and talk engineering on it. Are there any more questions, or are you?
Or you're tired. You're tired too.
Thank you very much.